All right, I think we can start now. And greetings, everyone. Welcome to today's webinar. I'm Kübra, representing IBM Technology, and I'm delighted to have you all here with us today. In this webinar, we will explore how intravital in vivo imaging techniques are currently being used and can be further applied to study the effectiveness of cell and gene therapies. If you have any questions during the webinar, please use the Q&A box below, and we will make sure to address all of them at the end. Let me introduce our presenters for today, Dr. Pirhan Kim and Dr. Chaeyok Shim. Dr. Pirhan Kim is currently a professor at the Korea Advanced Institute of Science and Technology and the founding CEO of IBM. Our second presenter, Dr. Jaeok Shim, is a tenured associate professor and director at the Medicine and Hore Gene Therapy Center at the UMass Chan and the Bone Analysis Corps. His research focuses on developing gene therapies for skeletal diseases using AAV-mediated gene transfer and modified siRNAs. Now let's hear some warm greetings from Dr. Pilhan Kim and Dr. Jaeok Shim. Could you please share a few words with our attendees?
Thank you, Kubra. Hello, everyone. Thank you for attending today's webinar. By the end of last year, we have started to use Intravital, the two-photon microscopy, for our research. With the support of the IBM technology team, we are now conducting on-site demonstration at the UMass Chan Medical School. Today, I will talk about developing novel gene therapy for skeletal rare disease and our ongoing application of the IBM intravital microscopy. For now, I will hand over the microphone to Dr. Kim for his introductory talk about intravital microscopy and live animal imaging at a cellular level.
Okay, thank you. Thank you very much. Hello, everyone. My name is Piran Kim. Thank you for joining for today's webinar. And then I'd also like to thank everybody. And then let me just begin my talk right away. So let me share my screen. All right. I believe everybody can see my screen, right? So let me begin. So thank you for joining us today. And then I'll talk about our intravital microscopy, intravital compoco, and two-photon microscopy system to you. So intravital microscopy is a technique that is capable of in vivo cellular-level imaging of various internal organs in a live animal. And also we can use intravital microscopy for the purpose of in vivo imaging analysis of drug delivery and drug efficacy, again, in a live animal model. Okay, so yeah, this is the very representative data you can expect to obtain by using intravital two-photon and confocal microscope. Compared to other imaging modalities such as X-ray, PET, CT, MRI, or IBIS, optical imaging system, intravital two-photon microscopy is capable of providing this microscopic, microscale cellular level from the live animal model in vivo. So this particular data was obtained from the lung of a live anesthetized mouse model. And then you can clearly see the movement of individual cell, in this case, it's a neutrophil, labeled by antibody flow conjugate, intravenously injected in red color. And then also you can see the blood flow in green color. So by just looking at this video, you can clearly see that the neutrophil is the one that making of this cluster by cell-to-cell interactions in just a couple of minutes. And then after this cluster formed, it completely blocked the bloodstream. So this kind of very dynamic phenotype, cellular level and physiological phenotype in a live animal can be clearly imaged by using intravital microscope. Well, in addition to this kind of cellular level response, we also can directly see the drugs in a live animal model. So this is one example. So this is the real-time video obtained from the liver of a live animal model. And then in this particular example, what you are looking at in red color is the intravenously injected nanoparticle. And then we are looking at the liver with the blood vessel in green color. And then you can clearly see how this intravenously injected nanoparticle flows inside the vessel in the liver, and then started to be accumulated in the certain site inside the liver sinusoid vessel, as you can see in here. So as I told you in the beginning, the intravital microscopy can be a useful tool to track the drug delivery, fluorescently labeled drug delivery in a live animal model. And then this is one good example of that. So in short, intravital microscopy can be a very useful technique because it can acquire this kind of live cellular-level video, live in vivo animal model with some molecular information, molecular and functional information. Okay, so the IBIM technology, we have been used the intravital microscope to image almost every organ and tissue in a live animal model. So as you can see in this slide, we have been able to image bone marrow, brain tumor, all in a live animal model. In cellular level, we have imaged the retina, skin, these are the hair follicle in the skin, tumor, various tumor model. This particular one is a colorectal tumor model, pancreas, spleen, stomach, intestine, adipose tissue, prostate, some transplant, kidney, muscle, liver, heart, and so on. So, impact, I'll say we can image almost every organ and tissue in cellular level in the live animal model. Okay, so to do that, we install this CMS3 model in UMass Chan Medical School. This is a dual mode intravital compact and two-photon microscope. So as you can see, it's very compact sized and in a single box, all-in-one packaged system. So it's quite easy to install. And then you can also save the space in the animal facility or in the lab. And then this is a very much optimized system for the in vivo cellular level intravital imaging of various internal organs in the live animal model. And then, as I told you, this microscope is capable of four-color two-photon imaging. And also at the same time, this microscope is capable of four-color compact imaging as well by using femtosecond pulse laser or 4 wavelengths CW laser, compact laser module. And then this microscope is a real-time imaging system. So by using very high-speed laser scanner inside, we can achieve the real-time imaging with the imaging speed of 50 to 100 frames per second at the 512 by 512 pixels per frame. So we can acquire at least 50 images in 1 second by using this microscope. And then based on this real-time imaging capability, this microscope is capable of automatic live tissue motion compensation function in microscopic cellular level scale. Okay, let me just show you several examples. So this is our preparation for the stabilized lung imaging in the live animal model, which I showed you in the beginning. So mouse is anesthetized, and then we intubate the mouse and then connect into the ventilator. And then by using this negative pressurized imaging chamber, so we can suck out the air through this hole, we can stabilize the surface of the lung against this transparent cover glass in 5 millimeter diameter in the middle. And then after this stabilization, based on our real-time imaging capability, we can directly see the flowing red blood cell inside the lung, as you can see in this video. But still, as you can notice, we still have this microscopic scale, tissue motion after this stabilization. And then this kind of tissue motion is much more severe when we try to do the other internal organs in the abdominal cavity. So we need to deal with this kind of tissue motion. So this is another example. This is the real-time video rate imaging video obtained from the kidney of a live animal model. So although we can, distinguish individual cell in this video, still, we have a very huge, tissue movement. So our approach is quite simple because we can image it in real time, even video rate of 30 to 50 frames per second. So we just, track the individual cells inside the images, and then we do the frame by frame motion compensation to correct this tissue movement. And then all this image registration and motion compensation can be done automatically by using our microscope and software. So this is the example. So from this kind of tissue movement video, we can do frame by frame image registration to compensate the tissue motion. And then you can see the result. You can compare the result with and without this kind of motion compensation functions. So after frame by frame motion compensate, image registration and compensation, and then removal of out of focal plane images, we can successfully obtain this very high resolution, high quality images from the moving tissue in a live animal model. And then this motion compensation can be done automatically. So this is the real softwares, UIs in our microscope. And then you just turn on the motion compensation function and press the button. And then in just a couple of seconds, we generate this motion compensated image automatically. So you don't need to do any code. You don't need to do any further manipulation. You just turn on the motion compensation function and then press the image capture button. Then you will get this stabilized motion compensated image from the moving tissue in a live animal model. And then also, this real-time imaging capability is a very good match with our AI denoising software. So 2 years ago, we published one paper with another professor at KAIST, Professor Yoon. And then we presented this automatic denoising software AI algorithm. And then this algorithm, the good thing of this AI processing algorithm is it doesn't need a pre-training. And then this is unsupervised AI model. So we can do denoising automatically. So this is the result. So on the right-hand side, this is the low real-time video, real-time video. And then after applying our AI denoising software, we can remove the noise and then increase the SNR more than 100 times. And then this is the result. And then so by just looking at these two video side by side, you can clearly see the impact of this denoising software, denoising AI algorithms. And this is another example. So this is a real-time video, and then this is the denoised real-time video obtained from the live animal model in the kidney. So we can directly see the flowing cells in very high resolution with a very high SNR, as you can see in here. Okay, so from now on, let me just quickly show the several examples of internal organ intravital imagings. So this is the preparation for the lung imaging. So this is our lung imaging window chamber. So you can build up the negative air pressure, stabilize the lung surface, and then after applying our automatic motion compensation function, we can obtain this high resolution time-lapse image, time-lapse video from the lung of a live animal model, which clearly shows the interactions of the neutrophil inside the vessel, as you can see in this video. So this is the representative images. So you can see how this neutrophil gradually make a cluster and disturb the blood circulation in this particular mouse model. And then this is the procedure, just to fun. So we first need to intubate our mouse model, and then we connect it to the mechanical ventilator to mouse to breathe air. And then we open the thoracic cavity like this, and then expose the lung, and then applying our stabilize the lung imaging windows to stabilize the lung motions. And then we put our mouse inside our microscope, and then put it on this heated and motorized stage. And then we just put the mouse under this large objective lens and obtain this high resolution videos. And then we can use the same principle of using negative air pressure to stabilize the heart surface as well, heart surface as well. So this is the heart imaging chamber, this 2 millimeter diameter window. And then after applying the negative air pressure, we can stabilize the surface of the beating heart, and then obtain this kind of microscopic videos from the heart. And then we can apply our microscope for all other different organs. This is another example. This is a 2-hour time-lapse video obtained from the popliteal lymph node. So this video clearly shows the extravasation movement of the T cell and B cell from this high-end submanual vessel lumen to the lymph node parenchyma. And then we can pinpoint the access site or extravasation access site of these two types of lymphocyte inside the lymph node, as you can see in this video. And then this is the video as the one I showed you in the beginning. So we inject the fluorescently labeled nanoparticle, and then we can directly see distinguish the individual nanoparticle inside the vessel, as you can see in these magnified videos. And then we can track the delivery and the distribution of this fluorescently labeled nanoparticle in the live animal model. Okay. And then this is another example that was the real-time accumulation imaging. And then this is the another example of the tumor nanoparticle delivery imaging result. So in this case, we make a breast cancer mouse xenograft mouse model, and then implant this dosage-simple chamber to repeat the imaging in the same mice model. And then this is 2-hour, 6-hour, and 24-hour after the intravenous injection or IV injection of this fluorescently labeled nanoparticle. The green color is the tumor cell, breast cancer cell, and blue color is the blood vessel, again labeled by their antibodies. And then, as you can see in these images, you can clearly see the increased delivery of the nanoparticle through the vessel over time. So when you compare this area, 2-hour, 6-hour, and 24 hours, you can clearly see the increased delivery of the nanoparticle to the tumor. And then we can also see distinguish the individual tumor cell that's targeted by this nanoparticle in a live animal model. And then the good thing of intravital microscopy is we can keep the mouse to be alive during the imaging, and then also we can save the mouse after our one imaging session. So we can repeat our imaging in the same mouse model, and then see the longitudinal changes in the same mouse model. And then not just a nanoparticle, we can image other type of drugs as well. So these are the two examples. On the left-hand side, the red color is exosomes. And then so we, as you can see in these images, we can directly track the exosome drug delivery to the target cell at 10 minutes and 30 minutes after IV injection of these exosome drugs. So as you can see in these images, we can clearly see the delivery of the exosome to the cell surface in 10 minutes after the injection. And then at 30 minutes, we can see the internalization of this exosome inside to the target cell. And on the right-hand side, this is the one example of antibody drug delivery monitoring in a live animal model for 48 hours. So this red color is the drug, and upper panel is the control, and the lower panel is the test drugs. And then by just looking at the image, you can clearly see these drugs, this test drug has better penetration into the brain tissue, crossing the BBB in the brain. So compared to that, this unmodified control drug, they cannot penetrate the vessel, and then at 48 hours, they simply disappeared from the circulations. So this is one good example of using intravital microscope to monitor the antibody drug delivery in a live animal model. And then also we can use intravital microscope to monitor the efficacy of some drug treatment. So this is one example. So again, this is a tumor model. The green color is the tumor cell, and red color is the blood vessel labeled by the antibody. And this is the exactly same vessel at day 7, day 10, and day 13. And then by just, then let me go to the next slide. And then by just looking at the upper panel is untreated cases. So there are huge vessel remodeling after 6 days. But with some anti-angiogenic treatment, we can clearly suppress this kind of tumor vessel remodeling, as you can see in this imaging result. And then let me show you several more examples of longitudinal repetitive images. So this is the images obtained from the bone marrow, so from day 2 to day 10. And then we can find the exactly same location inside the bone marrow, and then monitor the behavior of this transplant cell at the same site from day 3, 4, 5, 6, 7, and the disappearance of this cell, and then appearance of the new cells in the neighboring areas. So this kind of cellular level changes in a live animal model can be repeatedly imaged in the same mice model and then analyzed. Another example, so this is a pancreatic tumor model. So in this particular example, we implant the pancreas imaging window and then make the inject the pancreatic cancer cell into the pancreas, so make the orthotopic pancreas tumor model. And then again, we repeat the imaging every day from day 9 to day 14. And then we can clearly see how this tumor vessel is remodeled. Tumor vessel is interacting with this proliferating cancer cell inside the pancreas. Okay. And there is another technique which is called cranial imaging window. So it's very well established technique. So we remove the very small portion of the skull using a drill like this, and then expose the brain surface, and then cover the exposed brain with the transparent glass, and then seal all the exposed area with this pink dental cement. So after this surgery, we can clearly see the brain through this transparent glass, and then we can keep the mouse to be alive for more than a year. So we can easily track the changes in the brain for a very long time. So this is the one example. So this is the very typical the image we can obtain through this cranial imaging window. And then this is the brain surface. And then you can see these very large vessels in the brain surface. And then when we go into the cortex, so if you look at here, we can clearly identifying this large penetrating vessel into the brain. Okay, and then let me just show some example how we can use this cranial imaging windows to study the microinfarction in the brain. So in this particular example, so in green color, that's red blood cell. So it flows well, and then we find out the one single penetrating arteriole, and then make a thrombus inside this penetrating arteriole. So we can make a small mini stroke lesion in the brain. And then we check the RS productions and then cell deaths. And then we just repeat our imaging over 1 month and then see how the brain tissue, changes in cellular level. And then as you can see in here, we can see the brain edema at day 2 and day 3, and then resolution at day 5, as you can see in here, and then this cortical atrophy over time. So when you look at day 3, we can see the leakage of the dextran, as you can see in here in red color. But interestingly, they spontaneously recovered at day 5. So there are no leakage anymore. So this is the same area. So so there is a vascular leakage at day 3, but no more at day 5. So we just want to how this recovery can happen. And then we find out this pericyte, this red color is the pericyte. And then this is 1 day imaging from day 3.5 to 4.5. And then we can see this recovery of the pericyte, this red color pericyte on the blue color vessels. And then this is the key underlying cellular level mechanism that support this BBB function restorations in terms of vascular leakage. So to summarize, intravital microscopy is a very useful tool for this microscopic scale imaging analysis in a live animal model. So as you can see in this few example, intravital microscopy can enable dynamic 3D, real-time imaging of various cellular level dynamics in a live animal model. And then also for the drug development, this intravital microscopy can be a useful tool for the direct in vivo drug imaging analysis. So we can use intravital microscope to analyze the drug delivery to the target cell. And then also we can monitor the drug efficacy inside the target cell or target organ and to validate the mode of action of the drugs in a live animal model in vivo. So we can do this kind of analysis in all different organs in a live animal model. And then this microscope is installed in UMass 10. So please contact us if you want to have some hands-on experience with the intravital microscope there. All right, I will stop here. Thank you very much for your attention. And then I will hand my mic to the Dr. Sim.
Thank you, Dr. Kim. It's here. I'm gonna share my screen. It's here. Can you see the right mode or it's a different? It's a presentation style.
It's a presentation style.
I'm gonna. This is the right one.
Yeah, this is the right one.
Good. Yeah, thank you. Yeah, so today's I'm gonna briefly, it's not brief, is I'm gonna introduce the research project. It's about novel gene therapy approaches to treat skeletal rare disease known as fibrodysplasia ossificans progressiva. And also I will briefly touch is how we will apply intravital microscopy to our research. So FOP is an ultra rare disease. 1 in 1.2 million people has FOP and characterized by extra bone formation in skeletal muscles, tendons, ligaments, and joints after minor trauma or injections. So FOP patients grow up normal until flare-up appears. The flare-up is like inflammation. It's just like as ALS, rheumatic disease. When they have a trauma or something, they have the bruise, then they activate the inflammation, then they start to their muscle to become a bone. The average life expectancy is 40 years old, and most of patients die due to pulmonary complications. At the end, their rib cage is fixed because all the cartilage become a bone, so they cannot breathe well. So then the saliva is actually kind of accumulated in their lung and mouth. Then infection is caused. So current treatment options are limited to palovarotene and high dose of corticosteroids and several investigational drugs, clinical trials. However, these drugs have severe side effects, especially when we use for long term. So heterozygous, the gain of function mutation in the bone morphogenic protein receptor, ACVR1, the cause is classic FOP phenotype. So 97% of our FOP patients have the single nucleotide substitution, the guanine to adenine, which changes arginine to histidine in human ACVR1 gene, which is called as R26H mutation. So this mutation causes the leaky, the BMP signaling and the stronger responsive to BMP signaling and the binding activin A. So basically it's a ACVR1 receptor does not bind well to activin A because activin A is TGF beta ligand, TGF family ligand. But then once they are mutated, then it's bind really well, and then they activate BMP signaling just like a BMP ligand. Here is a brief overview showing how heterotopic ossification develops in FOP patients. So trauma-induced swelling and the flare-up, they induces production of activin A and the inflammatory cytokines in the muscle. And in FOP patients, activin A binds to mutant ACVR receptor in FAP cells, which is a fibroadipogenic progenitor cell, muscle-resident mesenchymal stem cell. So then induces their differentiation into chondrocyte, then osteoblast, then they start to make all the bones. There are several drugs, investigational drugs there. For example, there are the glucocorticoid. We literally treat the patients with glucocorticoid and stops the inflammation, or garetosmab, which is antibody drug, and they bind to activin A, then the blocks activin A bind to the ACVR1 mutant receptor, or saracatinib, which is one of the small compound inhibitor. They bind to ACVR1 active form receptor, but it cannot distinguish mutant versus wild type. And the last one is palovarotene. These retinoic acid, the gamma, the agonist, which is activating inflammation, but at the same time, the suppress achondrogenesis. So these drugs are there, and we are using currently for FOP therapy. But these the drugs, as I mentioned, there are several severe side effects, and also these are not directly target the cause of mutation or the cause of problem. So basically, they hit the upstream or downstream gene, and then they cannot literally cure it, and they just the short-term treatment. So it's to deliver our therapeutic gene to FOP causing cell, especially muscle progenitor cells, FAP, like a fibroadipogenic progenitor cell, and it's a heterotopic bone-forming cells. We use the recombinant adeno-associated virus, and adeno-associated virus is modified to deliver therapeutic genes to target cells without causing any disease, because they're inside all the bad materials they removed, they replaced with just the therapeutic gene. So basically, they only have the frame, but it's all the bad things is all took out. So AAV vector is composed of two key elements. The first one is an AAV capsid. So AAV capsid determines where to go. In our case, it targets FAP cells, becoming the heterotopic bone cells. And also, AAV vector genome contains therapeutic genes to silence mutant ACVR1 gene or add a healthy ACVR1 gene, or combination, like add a healthy ACVR1 gene at the same time silence mutant ACVR1 gene. So 97% of FOP patients, as I mentioned, 97% of FOP patients have a classic R26H mutation in the ACVR1 gene, and this gene causes all the produces the messenger RNA with the mutation. Then they make a whole ACVR1 R26H mutant protein. And first strategy is very simple. We literally introduce ACVR1 R26H specific artificial microRNA to the FOP cells, and then through this one, we can specifically remove ACVR1 R26H mRNA, though without disturbing the wild type ACVR1, the mRNA. So then we can literally reduce all FOP signaling. The second strategy is gene addition. So literally, so we add the codon optimized healthy ACVR1 gene to FOP cells and produce more normal ACVR1 mRNA to the healthy ACVR1 protein. So using this idea, we can dilute the ACVR1 R26H mutant protein levels. Then so we can dilute also FOP signaling too. The last one is the combination therapy, which is we can add gene silencer at the same time addition together. So using artificial microRNA, we can specifically remove mutant mRNA. Then we add the codon-optimized ACVR1, then we can generate a healthy ACVR1 protein. So with using this combinatory, the combination therapy, then we can literally shift all the mutant cell to the wild type cell. We generated AAV vector genome containing mutant ACVR1 specific silencer. We call AMIR RH1 or RH2, and this is AAV compatible, the artificial microRNA. Because when we use shRNA hairpin, size is too small, so they have a lot of the off-target effects happens. So we utilize we utilize endogenous microRNA scaffold. Then we change the target sequence to our target sequence. Then we call the artificial microRNA. So then we put it into the vector genome. And you can see here, red color represent the mutant ACVR1 mRNA levels, and blue color represent the healthy ACVR1 RNA levels. And compared to control treated the human FOP cell, these are human patient dermal fibroblasts derived the iPSC cells. And you can see 65% of mRNAs, they have a mutant ACVR1. Only 35% is a healthy ACVR1 mRNA. Then after treatment with AAV, especially our artificial microRNA, and this ratio is shifted. It's mutant down to 37% and 40%. At the same time, we can introduce a codon-optimized ACVR1 healthy gene, so then they also express healthy ACVR1 protein expression is here. So in control, treated the human FOP cells, activin A binding to mutant ACVR1 receptor and activates SMAD15 and upregulating ID1 gene expression. However, when we treated with AAV vectors, especially combinatory therapy, and activation of a SMAD15 and ID1 expression is dramatically decreased. For example, here, activin A treatment upregulate phosphorylation of a SMAD15, but it's after treatment of AAV, then they decrease. And also, activin A upregulates ID1 expression, and they are all decreased. And human FOP cells also can differentiate into alkaline phosphatase expressing pre-osteoblast to the mineral expressing mineral producing osteoblast. Then compared to control treatment, it's here and here. AAV treatment significantly decrease alkaline phosphatase levels up to here, and also mineralization is down to here. Thus suggesting that our AAV gene therapy is a potent suppressor of osteogenic differentiation of FOP cells. Because the intramuscular injection itself causes damage to muscle, and then those damage actually induce heterotopy bone formation in FOP patients. So these are kind of very bad because these are main reason why is FOP patients cannot get immunization, because most of the immunization through intramuscular injection, when they get the intramuscular injection, then they start to have bone. So most of FOP patients cannot get immunized because of this reason. So we cannot use normal intramuscular injection, then we use the hollow microneedle with 0.6 millimeter needle size is here to deliver AAV vectors to dermis area. Then there they diffuse to dermis through the sub-Q, and then they diffuse the muscle. So this idea in HO skeletal muscle of FOP mice, the AAV transduced cells show the green color. The AAV really well transduced muscle. You can see all the green. And also purple cells, those are all the bone marrow cells, as well as the FAP cells are here. And then yellow color, which is HO forming FAP cells with AAV transduction. So this data clearly demonstrate that it's a local delivery of our AAV vector is very effective for entering muscle cells as well as HO forming FAP cells in FOP. So to test therapeutic efficacy of our AAV gene therapy in FOP mice, we treated the 6-week-old FOP mice with transdermal injection using that hollow microneedle, AAV vectors, and then we induced the HO in skeletal muscle using pinch injury. Just a single pinch injury in the muscle, the muscle turning into bone. And then it's just 4 weeks later, we sacrificed the mice. Then we check the bone formation using micro-CT. So as you see here, pinch injury induces a huge bone formation in the muscle in control-treated mice. But when you treat it with the combination AAV therapy and heterotopic bone formation is dramatically decreased. And also the gene silencer alone, which is ACVR1 mutant specific gene silencer, or overexpression of a healthy ACVR1 alone also decrease bone formation too. So these suggest that local delivery of our gene therapy is highly effective for suppression of trauma-induced HO in FOP mice. So similarly, when AAV vectors were systemically delivered to FOP mice at birth, as soon as they're born, we injected it, because FOP patients start to develop HO is around 6 months old. It's very young, but very diverse. Some patients start from 6 months old. Some patients is after puberty. So kind of very, very diverse. But if we treat them very early, then even better, because even before the symptom happens, and we can block it. So AAV-treated mice become resistant to trauma-induced HO. This is kind of what we want to do. So then as soon as FOP mice born, then we injected the mice with AAV vectors through IV injection, intravenous injection. Then we waited 6 weeks, and then we induced the pinch injury to the tibial muscle. Then we waited 4 weeks, and then we checked the heterotopic bone formation in the muscle. Then as you see here, control treated mice is a make us a big heterotopic bone in the muscle. And here is the muscle. And then these are green, the blue colors, those are cartilage. And then here is the bone marrow, and this is a bone. So literally they make an independent bone formation in the muscle. However, after treatment with the gene silencer only or healthy ACVR1 overexpression, they dramatically decrease size of heterotopic bone formation in the muscle. But most importantly, when you treat it with a combination, overexpression of a healthy gene at the same time is a gene silencing over early specific deletion, then you can see almost completely remove the bone formation. So these results suggest that combinatory approach is most effective in preventing HO-induced, trauma-induced HO in FOP mice. And not only traumatic HO, but also spontaneously developed HO. So the patients, even without any trauma, so they spontaneously develop HO throughout their whole body. So we found that our AAV is not only traumatic HO, but also spontaneously developed HO can be prevented by our AAV gene therapy. So we intravenous injection of FOP newborn mice with mutant ACVR1 specific silencer here, or the overexpression of a healthy ACVR1 or the combination, those are all three is a highly effective to prevent spontaneous bone formation. However, you can see that they still have some in gene silencer alone or overexpression of a healthy gene. However, as you see here, the combinatory approach is removing the mutant and expression of a wild type or healthy ACVR1, they almost completely prevent a spontaneous HO in FOP mice. In summary, we successfully packaged the AAV vector genome containing both the gene silencer here. This is a mutant-specific gene silencer as well as a healthy ACVR1 gene into one genome vector. Then we package it into AV9. Then through IV injection, intravenous injection, we can deliver to the skeletal muscle, especially FAP cells and heteropathic bone osteoblast. So then we can selectively remove the mutant ACVR1 mRNA. At the same time, we can express healthy ACVR1, then we can changing FOP cells to normal healthy cells. So then is this idea with this, and how are we going to use our intravital microscopy to our study? So interestingly, is FOP shows a sequential progression of a heterotopic bone formation in the muscle when they have a trauma occurs. So injury induces a muscle degeneration, followed by inflammation and proliferate. Fibroblast proliferation is here within 3 days. Then fibroblasts then turning into chondrocyte for cartilage formation in 7 days. At 14 days, 2 weeks later, chondrocyte is further transformed to osteoblast, then making bone. 4 weeks later, independent bone formation with the bone marrow is developed, is here. This is a kind of all heterotopic bone. This bone has all the bone marrow established here. Why is bone marrow so much important? Because bone marrow has a lot of cell population for the immune cells at the same time. FAP cells, it's multiple nutrients there. Then they don't need anything else. They just themselves, they feed themselves. They keep growing with this independent bone formation. You can see similar to control treated FOP mice here. This is a control mice, and these are AV treated mice. So control treated mice shows a normal muscle regeneration and inflammation in 3 days after pinch. And also AV treated the same thing. Muscle regeneration happens, and also inflammation happens. But what's the difference is that the 7-day FOP mice, FAP cells, they transformed to chondrocyte and they start to produce cartilage. However, AV treated mice, they are not going into chondrocyte, then they back to the muscle. So the FAP cells proliferated, they start to die, and also immune cells, they accumulate, they start to leave. So then muscle regeneration happens, and then BMP signaling is going down, and they gradually comes back to normal. But as FOP mice, they change to chondrogenesis and osteogenesis, making cartilage and bone, they go to their route. So looks like our AAV is the works between inflammation to the chondrogenesis. Then what we want to do is that we want to monitor cellular dynamics during a progression of a heterotopic bone formation in FOP mice. So I strongly believe that the IVIM intravital, the 2-photon and confocal microscopy is literally, we can see how these after pinch, all the cellular modification happens, and then together with the phenotypic modification happens. So because it's an intravital microscopy, can do all the longitudinal imaging. So this microscopy, thanks to our IVIM technology team, we installed into our new building, the nerve building in the animal facility. And those are A level, one of the best level, the clean facility. So even after surgery, they not gonna die because of infection. So as you see here, this is the 2D image. I mean, you can see our traditional histology shows a 2-dimensional static view of FOP tissue. I mean, HO tissue. Here is the bone formation here, and these are all the FAP cells, HO-inducing FOP cells are here. But this is it. I mean, we need just static view and two-dimensional. But if we use our IV microscopy, now you can see 3D image is here. is here is all the muscle, degenerated muscle is there, and blood vessel formation and vascularization is happens, and at the same time, HO causing FAP cells, those are all the green cells, they start proliferating. So this one is so even we can do all the 3D image and movie formation, but unfortunately, so we don't have an IQ approval yet. So it's these are all the we just kill it and then we just do imaging it. Now so we are waiting for the IQ approval for live animal imaging. Especially we are very interested in the longitudinal animal imaging. So we have a lot of collaborators in our schools, and also we are very appreciative is I-beam technology because they are so generous because they allow us to use for 1 year on-site demonstration. This is a very helpful to our investigators in UMass Chan Medical School. Thank you.
Thank you so much, Dr. Shim, for a great presentation, and also to Dr. Pihan Kim. We will now open the floor for more questions about the specific applications maybe you have in your mind. I have already answered a couple questions about the cost and accessory supplements. So if you have further questions, you can ask them now or send through email information at ivimtech.com. Yeah, if you have no questions, I think with this we will cover this session. Thank you so much for your engagement. Before we wrap up, I have a reminder about the upcoming imaging workshop at UMass Chan. The workshop is scheduled for the second week of April from 7 to 11, and there will be a seminar and maybe a snack session on Thursday mornings. Anyone interested in experiencing this technology in real time is welcome to participate and perform in vivo imaging of their target organ. So if you are interested, please contact us through information at ivimtech.com. I guess we have one question came just now. Are there any limitations in terms of using C+7 BL6 mice due to dark skin?
Okay, let me answer that. Well, not much actually. So we can easily use common black cis mice for intravital imaging. Yeah, with the dark skins too, we can do pretty good intravital. We can obtain pretty good intravital imagings. So it's not a problem.
Yep. If you have more questions, please don't hesitate to ask them.
Oh, Kubra, by the way, is I-beam technology team gonna be in UMass between April 7 to 11. So they're gonna whole week in UMass Chan, and they're gonna give us on-site animal surgery the training, and at the same time they can offer the individual lab the seminar too. So if anybody interested, please let Kura know. Then it's we can arrange this all meeting too.
Yeah, absolutely. Thank you so much for the reminder. As Dr. Shim said, we will have the workshop on the second week of April, and we are planning even more workshops throughout the year. So even if your schedule doesn't fit for this time, please contact us whenever you have the availability and want to see the system, and we will be happy to help you. Thank you everyone for your engagement again. Thank you, Dr. Shim, Dr. Kim, for your presentations and your time.
Thank you.
Until next time.
Yeah, thank
Thank
you.
you.
Thank you
Bye-bye.
very much.